Hello and welcome to Crack the Boards. If you're new to this channel is dedicated to helping you excel in the USMLE. So be sure to subscribe, like, and share to support the channel and stay updated on our latest content. In today's video, we will focus on USMLE questions related to histology and cell biology. Let's have a look at the first question. A 65-year-old man presents with a 5-year history of frequent heartburn. He reports waking up in the morning with a sour or acidic taste in his mouth. An upper endoscopy is performed and a biopsy sample from the lower esophagus is obtained as shown in the image. Based on his condition, this patient is most at risk for developing which of the following complications? A. Adenocarcinoma. B. Helicobacter pylori infection. C. Obstruction of the esophageal lumen. D. Squamous cell carcinoma. The correct answer is A. Adenocarcinoma. This patient has chronic gastroesophageal reflux disease and has biopsy findings of intestinal metaplasia with mucus-secreting goblet cells that confirm a diagnosis of Barrett's esophagus. A normal esophagus would show solely non-keratinized squamous epithelium. Barrett's esophagus can develop into esophageal adenocarcinoma. Let's have a look at why the other options are incorrect. Option B is incorrect as Helicobacter pylori infects the pylorus and the antrum of the stomach. But for this patient, biopsy was taken from the lower esophagus. Option C is incorrect as esophageal cancer in late stages can cause esophageal obstruction, but would be seen on the endoscopy and would have a different histologic appearance. Option D is incorrect as the biopsy shown is from the gastroesophageal junction. Adenocarcinoma tends to develop from the lower esophagus, whereas squamous cell carcinoma develops in the mid to upper esophagus. So for this patient, the biopsy, since it was taken from the lower esophagus, it is more at the risk of developing adenocarcinoma rather than squamous cell carcinoma. Let's have a look at the second question. A 50-year-old woman visits her doctor after noticing a lump in her neck for the past 2 weeks. Examination reveals an enlarged, painless lymph node on the lower left side of her neck. A histological section of the lymph node is obtained. What is the most likely origin of this tumor? A. Breast. B. Larynx. C. Lung. D. Thyroid. The correct answer is D. Thyroid. The patient has papillary cancer of the thyroid that has metastasized to the cervical lymph node. The photomicrograph shows a papillary tumor with multiple psammoma bodies, which look like dark blue concretions. Papillary carcinoma occurs most frequently in women between the ages of 20 and 50. It is the most common type of thyroid cancer and spreads via the lymphatic system. Let's have a look at why the other options are incorrect. Option A is incorrect, as breast cancer usually metastasizes to the axillary or internal mammary lymph nodes rather than cervical nodes. In addition, psammoma bodies are not present in breast carcinomas. Option B is incorrect, as the majority of laryngeal cancers are well-differentiated squamous cell carcinomas. Option C is incorrect, as lung cancer does metastasize to cervical nodes. However, psammoma bodies are not present in any of the cancer types, regardless if it's a squamous or small cell or adenocarcinoma of the lung. Let's have a look at the third question. A 21-year-old woman presents with breast pain and a feeling of lumpiness. She reports that the pain intensifies in the days leading up to her period and subsides afterward. She has no family history of breast cancer. On examination, a tender mass is noted in the upper outer quadrant of her left breast, with no palpable axillary lymph nodes. What is the most likely description of the appearance of the breast lesion? A. Blue dome cysts. B. Calcified nodule. C. Dilated ducts with inspissated section. D. Irregular hard lump. The correct answer is A. Blue dome cysts. Blue dome cysts are a component of fibrocystic change. Fibrocystic change refers to a spectrum of changes that occur in the breast tissue of women during the menstrual cycle. Non-proliferative changes that cause lumpiness of breast tissue include increase in fibrous tissue in the stroma and formation of cysts of varying sizes. These proliferative changes are caused by estrogen. Painful breast lumps enlarge as fluid accumulates in cysts. These changes regress after the menses end. Let's have a look at why the other options are incorrect. Option B is incorrect, as calcified nodule. This is a feature of fat necrosis of the breast and does not show the cyclical changes described in this question. Fat necrosis of the breast is often associated with trauma and presents as a painless lump with abnormal calcification on mammography. Option C is incorrect, as this is a feature of duct ectasia. It will not show cyclical changes as described in the question. Mammary duct ectasia is most often seen in postmenopausal multiparous women. It presents with a periareolar mass with green, white, or brown nipple discharge. And option D is incorrect, as An irregular hard lump is a feature of carcinoma. It will not show cyclical changes. This concludes today's set of questions. Thank you for watching today's video. If you enjoyed it, please don't forget to subscribe to the channel to stay updated on our latest content and to support our journey.